HD Lab Skills.
Hello there, HD Lab Skills, Intellects and Elites. Welcome to yet another video, and today we shall be focusing on phlebotomy skills. What is phlebotomy? Phlebotomy is the process by which we collect blood from patients in a special room set aside for that particular function. Now, blood collected for routine lab can either be collected from the veins or the capillaries. The blood must be collected with care and adequate safety precautions to ensure test results are reliable. During blood collection, it's important to ensure that all necessities of the collections are placed on site. Client or patient is seated comfortably, preferably in privacy. Create a rapport between you and the patient, then ensure that technique is carried out aseptically as possible. The one collecting blood should be well trained and confident. After blood has been collected, the used materials must be disposed of in a manner that ensures maximum safety to all people using that place. Any spillage must be cleaned out thoroughly. Now, we'll dive deep into capillary blood collection first. In capillary blood collection, capillary blood is collected when small amount of blood is needed, for example, the blood slide for malaria parasites, or when it is impossible to identify a vein either due to obesity or scary sites of venous collection. Requirements: you will need a blood lancet or a pricker. You will need a receptacle for blood collection. It could be a slide, a test tube, it could be a dropper, etc. Cotton wool swabs that are soaked in 70% alcohol, okay, and any other requirement as per the need. Then straight into the procedure. First, you identify the site of blood collection. The site of blood collection could be the ball of the middle finger, ball of the big toe, the heel, earlobe, etc. Avoid places with scars. The choice of site will depend on the age and presence of scars and hardened tissue. Young infants go for the heel or the big toe. Warm the area by rubbing, especially from the heel of a baby. Clean the site with soap and water if possible, then disinfect the place using antiseptic and let it dry before you stab. Make a quick stab 2 to 3 millimeters deep. Collect the appropriate container by applying a little gentle pressure to ensure free flow of blood. If too much pressure is applied, tissue fluid or interstitial fluid is likely to mix with the blood and hence low concentration of the blood, and as a result, distorted results. Dispose of all the used materials in the appropriate waste containers. Each and every phlebotomy procedure has its own advantages and disadvantages. Some of the disadvantages of using the capillary blood is that it can only be used for a few tests. Okay, there is greater possibility of sampling error, especially when the blood is not free flowing. There could be dilution of the blood with the tissue fluid if punctured area is squeezed excessively. It is difficult in obtaining sufficient blood, particularly if it is required for more than one test. Clotting of blood in micropipettes may occur. Tests can be repeated immediately or further tests performed when the results are unexpected or seriously abnormal. A patient may also have received treatment before collection of the capillary sample. for example, anti-malarial drug, which will make it difficult to find parasites at a later stage. Some of its advantage is that a small amount of blood is used, no anticoagulant is used, and it is easy to obtain capillary blood as compared to venous. Before collecting the capillary blood, you should remember to wipe the first drop of blood with a dry piece of cotton wool and use the next few drops for the test because of the interstitial fluid. Now, let's dig deep into the venous blood collection. The requirements are a syringe, needle, an antiseptic which is 70% alcohol, a short needle of 10 milliliters can be used and it's suitable for children, which is referred to as the scalp vein or butterfly needle. You'll need a pressure cuff, a specimen container, soap, and water. The procedure. First, identify the patient prior to blood collection. The patient should state his or her name or other identifying information, and it should match with the info on the request form. Now, the second procedure, identify the site seeing the veins or palpate with fingers. Okay, apply pressure cuff or a tourniquet to the upper arm, which is placed slightly 3 fingers above the puncture site. Now clean the site to be punctured properly using either 70% spirit or 70% methanol and allow the area to air dry. Ask the patient to make a tight fist, which will make the vein more prominent. Enter the needle into the vein, which could be the cephalic vein, the median cephalic, or the median basilic, the one that is more prominent. Okay, now the bevel of the needle and scale on the syringe should be facing upwards. The needle and syringe must be tight. Make a venipuncture by quickly inserting the needle into the vein at an angle of 10 to 20 degrees. A greater angle could lead to double puncture of the blood vessel, resulting in blood drainage into the surrounding tissues. With one finger, on the other hand, pull the piston or plunger slowly until you have the required amount of blood, avoiding moving the needle in the vein. Okay? Now, when the sufficient blood has been collected, release the tourniquet and instruct the patient to release his fist or her fist. Remove the needle and immediately press on the puncture site with a piece of dry cotton wool. Then remove the tourniquet. Instruct the patient to press the site until the bleeding stops. Do not tell the patient to fold his or her hand, as these may dislodge the clot already formed. Remove the needle from the syringe and fill the containers with the required volume of blood. Do not recap or resheath the needle. The syringe and the needle should be discarded appropriately in a safety box. Do not fill the container with the needle attached to the syringe because forcing the blood through the needle can cause hemolysis. Mix the blood immediately in ADTA or citrate anticoagulated container. Don't shake the cells vigorously as they may hemolyze. Label the blood samples. Check whether bleeding from the venipuncture site has stopped. Cover the area with a small dressing, elastoplast or any other type of dressing. Okay? Now, That is the procedure of a venipuncture. That is it for this particular video. I hope you learned one or two, and if you gained something from this video, don't forget to leave me with a like, comment on the comment section, and most importantly, don't forget to subscribe to my channel for more videos.